Hi, welcome to this webinar this afternoon, UK time anyway. We'll just give it another 30 seconds and then we'll kind of get started. But yeah, welcome and thank you for joining us. So for those of you who are just coming in, we're just going to start. Hello and welcome to this webinar. We're hosting this webinar today as the 74th World Health Assembly comes to a close. Today we'll be discussing malnutrition and its disproportionate impact on women and girls. My name is Alan Lally Francis. I'm the chair for today's webinar. I'm the head of policy advocacy at Results UK. Who are Results? We're an advocacy organisation that will be celebrating our 35th anniversary this year. Our mission is quite simple. We create the public and political will to end extreme poverty, and we do that through a combination of policy, parliamentary and grassroots advocacy in order to achieve this. Just a bit of housekeeping before we start. This webinar is being recorded, so if you're more comfortable and you'd rather not be recorded, feel free to turn your cameras off. Please also ensure your microphone is set to mute, although I think we have handlers who will are able to take care of that anyway. So in terms of this webinar, we'll be hearing two presentations, around 15 minutes each. Then at the end of those presentations, we'll have a 15-minute question and answer session. The process for asking questions is, if you'd like to ask a question for one of our panelists, please just type into the chat box below, and then we'll get to as many as we can within the time towards the end of the webinar. So just to kind of set the scene a bit, as we know, global pandemic, it's had devastating consequences on global health, and this includes on malnutrition. We are now halfway through the Nutrition for Growth Year of Action, and we know that advocating for good nutrition and for a successful Nutrition for Growth Summit at the end of the year is crucial for mitigating the impact of COVID on malnutrition. We also know that malnutrition disproportionately impacts women and girls, and that governments have a responsibility to ensure that gender equality and the rights of women and girls is achieved, including around health and nutrition, and through meaningful pledges in the Nutrition for Growth Year of Action. So it's vital more than ever to amplify the message that nutrition is a key factor for human health and well-being, while also being a fundamental element to achieving gender equality. So enough from me, and moving on to the main event. On the panel today, I'm pleased to say we have Mathilde Chiesa. She's the Policy Advocacy Officer on Nutrition at Results UK. We're joined by our great partners at Nutrition International. They are Sarah French, who's the Policy and Advocacy Officer there, and then also Yasmin Val, who's the Programme Officer at Nutrition International. So to begin the first part of this webinar, we'll be hearing from Mathilde, who will be launching Results UK's latest policy paper titled Malnutrition is Sexist. So on that note, Mathilde, over to you.
Thank you, Alan, and hi everyone. Very happy that you could join this webinar as we launch our new policy briefing on the determinants of nutrition for women and girls. So my name is Mathilde Chiesa. I'm the Policy Advocacy Officer for Nutrition at Results UK. And apologies for not sharing my camera at the moment because I'm sharing the slides. So I just want to make sure that my Wi-Fi system, as the Q&A session, I will turn it on for a more interactive discussion. So during my presentation, I will talk about the background of this work for the policy briefing and explain the main finding of this report. So first thing first, at Results UK, we are advocating for a rights-based approach to nutrition. It is important indeed to start with this baseline, as this year, the 2021 Nutrition for Growth Year of Action, our policy advocacy for women and girls nutrition started with the launch of the report Nutrition as a Human Right. And our advocacy for women and girls nutrition and the reports, the briefing we are launching today is in continuity with our rights-based approach. So this advocacy for nutrition is based on the idea that human rights standards consider malnutrition and gender inequalities as injustices by recognizing health and fundamental rights as interdependent approaches to defining and advancing human well-being. So just to recap about human rights, we know that they are all universal, inalienable and interdependent, which means that they are all inherent to all human beings. They are all equally important, and one set of rights cannot be enjoyed fully without the other. And since good nutrition for women and girls involve a variety of interventions, for example, in agriculture or in the access to nutritious food, knowledge of nutrition, access to nutrition health, social care, it follows naturally that the realization of the right to adequate food and good nutrition will be linked to the accomplishment of other human rights. So these include, for example, the right to health, to give access to primary healthcare, nutrition care, the right to property, giving access to land, productive resources, of course, the right to be free from discrimination, which is a requirement to remove all the barriers interfering with the access to health services, education, and other necessary for producing food. And the right to education for use of basic knowledge on health and nutrition. But this is really a non-exhaustive list because the realization of many other women and girls' rights condition nutrition outcomes. And some international human rights conventions, such as the Convention on the Elimination of All Forms of Discrimination Against Women that you have in this slide, stipulates that women's rights to health can be achieved only if global governments fulfill their obligation to respect, protect, and promote women's fundamental human rights to nutritional well-being through their lifespan. So in front of you, you have an example, which is the Article 12 of this convention that reiterates the right of all women to adequate nutrition. And the general recommendation number 24, which has been drafted by the United Nations Committee attached to this specific convention, provided some clarification on the recommendations and the key measures that all governments need to implement for the realization of this specific right. But more than this convention calls for appropriate measures to eliminate discrimination against women, because their right to good nutrition is affected by various structural issues, which must be addressed in order to allow access to better nutrition. These structural issues are found, for example, in access to health, but also in cultural practices around food and socio-economic status of women. So, which is why to realize women and girls' rights to good nutrition, gender equality should be considered as a social determinant of nutrition. And to explain the disproportionate impact of malnutrition on women and girls, and to address the various underlying structural issues that increase their risk of malnutrition, we are launching today the policy briefing, Malnutrition is Sexist, the Determinants of Nutrition for Women and Girls. I will share a link to this briefing later in the chat box. And in this briefing, we explain the nutrition challenges facing women and girls, which are coming from physiological factors, but also on social determinants. And in the briefing, we also call for a multisectoral approach. By multisectoral approach, we mean collaboration among various stakeholders groups and development sectors in order to jointly achieve gender equality with nutrition interventions. So nutrition is indeed a gender issue. We know that more than 1 billion women experience at least one form of malnutrition worldwide. They experience higher rates of anemia, overweight, and obesity than men, and especially women with lower socioeconomic status. And we even found in the briefing that malnutrition is the single largest cause of death among women, killing more than any other risk factor. So, and that includes alcohol and tobacco. And from what we could expect, the COVID-19 pandemic has exacerbated the already existing burden of malnutrition in women and girls. So achieving gender equality will not be possible as long as women and girls suffer from malnutrition at a much higher rate than men and boys. So it is therefore essential to understand the nutrition challenges that women and girls face. And in the briefing, we first focused on the physiological factors, making women and girls particularly vulnerable to nutritional deficiencies. And these are actually illustrated in this slide. So this table describes the nutrients that are needed specifically by women and girls and the risks if these nutrients are not available to them. So we took the example of iron and the associated risk if they are not consumed enough quantity. We did the same for iodine and vitamin A. But in the briefing, we specifically focused on anemia. So for those who are not familiar with the term, anemia is a nutrient deficiency caused by a lack of iron. It reduces the capacity of blood to carry oxygen around the body, and it can result in severe fatigue, poor concentration, pregnancy complications, and increased risk of developing heart diseases. And due to the loss of iron during their monthly periods and their increasing needs of iron during pregnancy and when breastfeeding, women of reproductive age are more likely to be affected by anemia than men. It is, for example, estimated that 613.2 million adolescent girls and women aged between 15 to 49 years old in the world are affected by anemia. And COVID-19 could result in an additional 2.1 million maternal anemia cases by next year, 2022. So the high prevalence of anemia in women demonstrates a lack of sufficient access to iron-rich food and other nutrients that absorb iron. And from this fact, we found that the case of anemia reveals a gender inequality issue, as it highlights the difficulties women have in accessing the food and the conditions they need to have a nutritious diet and to be healthy. And it's also important to remember the generational consequences of malnutrition in women and girls. For example, if a woman becomes pregnant, it is known that anemia and other macronutrient deficiencies will increase the risk of having a baby that has a low birth weight, or it could result, for example, in premature birth or child cognitive impairments and other complications that will either affect the development of the child or result in child death or lifelong disabilities. And remember, when I mentioned that by next year, COVID-19 could result in an additional 2.1 million maternal anemia cases, this also predicts a generational impact on children's future educational and economic opportunities, perpetuating the cycle of poverty and inequalities. So the higher rate of anemia and micronutrient deficiencies in women and girls also reveals a variety of societal factors, making women more susceptible to malnutrition than men. So as I've said earlier, good nutrition outcomes for women and girls depend on the realization of several human rights. So it means concretely that many interventions across different development sectors are involved. And these interventions are needed to address the social determinants of nutrition as key drivers to women and girls' health and development. So this entails removing the economic, social, and cultural barriers that create the underlying and systemic causes of gender inequalities and malnutrition. So in the briefing, we've shown how malnutrition in women and girls is associated with social determinants, such as insufficient access to quality education. And we even found the example in stunting. So for those who are not familiar with the term, stunting is an undernutrition condition when a person has a low height for his or her age. And with stunting, we found that it is higher among children with mothers that are less educated in comparison with mothers with higher level of education. But this is only one example, as many social determinants and institutional structures also reinforce gender inequalities that impact women and girls' health and nutrition. And these barriers They are found in food systems where women's roles vary disproportionately and where they continue to face discrimination, for example, in decision-making or in access to information, in access to land and resources, but they also exist in health systems. For example, we know that during the COVID-19 pandemic, and still currently, nutrition health services, so those delivering essential nutrition care for women and girls, they are still often considered as non-essential services. So what does this reveal in terms of needed solutions? This reveals that to secure good nutrition outcomes in women and girls, achieving gender equality is a requirement. And this includes treating gender equality as a social determinant of nutrition, while simultaneously also ensuring that policies and programs work across sectors to foster new environments where women and girls have equal treatment and opportunities as men. And to enable this, a greater focus on women and girls' rights with a multisectoral approach is needed to make the management of malnutrition a discipline in programs across development sectors. So in the briefing, we highlighted 2 examples of interventions that illustrate the needs of a multisectoral approach. The first one is on breastfeeding, and the second one is on education and nutrition interventions, which I invite you to have a look at in the briefing. However, promoting gender equality in nutrition interventions is simply not enough to make progress in ending malnutrition for women and girls, because we need clear actions and political commitment at the highest level of national governments and increased financing to enable the implementation of nutrition enhancing strategies. Which is why the recommendations that we have written in the briefing are calling for actions from governments at the upcoming Nutrition for Growth Summit at the end of this year. We advocate that political and financial commitments from governments is the essential step to align objectives, implement policies and programs, and enhance women and girls' nutrition outcome. So as part of the N4G Year of Action, we need to continue to advocate for a successful summit to ensure that progress is made in addressing the determinants of nutrition for women and girls. So thank you all for your attention during this presentation. I hope you will enjoy reading the briefing, and I'd be happy to answer your questions during the Q&A session. So thank you very much, and back to you, Alan.
Thank you very much, Mathilde. Some very valuable insights and quite a comprehensive overview of such an important issue. So yeah, congratulations for writing such an important paper kind of on the subject. Yeah, as Mathilde said, the report will be available kind of, we'll put it in the chat box, but you can kind of, it'll be on Results' website, and yeah, you can also follow kind of accounts of like Sarah, Jasmine, and Mathilde for more musings around nutrition. And yes, I did just push out and promote their Twitter accounts. But now we're going to hear from Sarah and Jasmine from Nutrition International, just very briefly. Nutrition International is a global nutrition organization headquartered in Ottawa in Canada. They've been around for kind of around 30 years. And in that time, Nutrition International has delivered low cost, high impact nutrition interventions to people in need and working in more than 60 countries, primarily on the continents of Asia and Africa. So working alongside governments as an expert ally, Nutrition International, or NI as they're known, combines technical expertise alongside a very flexible approach, focusing on increasing impact, but without increasing complexity and cost. So at the moment, one of the things Nutrition International is working on, they're working in a coalition of nutrition and health focused organizations to ensure that women and girls are at the center of nutrition approaches, and also that the 2021 Nutrition for Growth Summit in December this year puts a spotlight on women's and girls' nutrition and gender equality. So on that note, I'll kind of hand over to Sarah and Jasmine. Over to you.
Yeah, thank you so much, Alan and Mathilde, for letting NI be here today and to speak about this really important topic, and the freedom from hunger and malnutrition. You know, recognizing that it is seen as a critical component for the enjoyment of all human rights. Malnutrition limits the ability of an individual to reach their full potential. By preventing the full development of the brain, it prevents the body from growing properly and the immune system from working effectively. Just some examples: iron deficiency during infancy and early childhood can have long-lasting detrimental effects on neurological development, leading to delays in social, emotional, cognitive, motor, and neurophysiological functioning for children. For adolescents, particularly for women and girls, as Mathilde had mentioned, anemia has shown to cause negative effects on test scores, concentration, and overall academic achievement. It has also been a leading cause of death for pregnant teenagers and leading cause of disability for adolescent girls. The consequences of malnutrition can be lifelong and are generational. They affect the social, economic, and cultural aspects of an individual, their family, and their community. Access to nutrition services and nutritionally adequate food and safe food, particularly for women and girls, is recognized as a determinant for other rights, such as an adequate standard of living, to the right to health, to educational attainment, and to an individual's ability to make choices throughout their life. For women and girls, good nutrition and gender equality are mutually reinforcing. Improved nutrition is critical to achieving gender equality, and in turn, as you improve gender equality, it leads to an improvement in nutrition. So if we think, how does this work? Girls with access to good nutrition are better able to learn. They're well nourished. Girls will have access to education, will learn more, and over their lifetimes earn more. When women come together as trained community healthcare workers, as mothers, and as community decision makers, they benefit their communities and themselves as they share their knowledge and collectively take action to address nutritional barriers. When nutritional programming recognizes household gender power dynamics and relations and respond by ensuring both parents and partners and family members are informed and involved, this encourages equitable decision-making for improved nutrition. And it supports optimal breastfeeding, care seeking during pregnancy, and taking daily and weekly iron folic acid supplements to prevent anemia, as an example. This goes a long way in promoting and advancing gender equality. And a key component of this is, men have many roles in society, as fathers, as partners, healthcare providers, leaders. And when children and adolescents see male role models displaying positive masculinity, that enables an equitable distribution of household nutrition, of health decision-making and caregiving, as well as health-related responsibilities. And this can have a multifaceted effect on the promotion of gender equality, on women's empowerment, and in the long term on nutrition. From a human rights lens, health and nutrition and social support for women and girls is the foundation for realizing their goals and ambitions as a whole and multifaceted person. It includes reproductive health, physiological well-being, the health of children. This perspective elevates the needs and the rights of both the baby and the child and the mother to high quality, accessible care. And if this happens, for this to happen, we really do need to look at putting women and girls at the center, where women and girls' rights to health and nutrition during pregnancy focuses not only on the needs of the infant, but also recognizes the unique and valid needs of women and girls for their health, their nutrition, social supports as a path to fully realizing their potential through every stage of life. And as Alan mentioned, we're working on some really exciting coalition to try and use this shift with other nutrition and health organizations in Canada to develop the gender transformative framework for nutrition. And I'd just like to share some slides on this. Bear with me 1 second. So the GTFN is a conceptual model that's supported by research and practice to improve nutrition approaches and interventions towards achieving gender equality. It focuses on empowering women and girls as transformational change agents themselves, equipping them with decision-making skills, nutrition knowledge, and providing access to education-based nutrition interventions that help to alter power dynamics at the household, community, and social levels. And my colleague Jasmine will speak to a brilliant example in a moment. But first, I just want to get back to the framework and really kind of unpack that a little bit. Let me just change slides here. So the GTFN starts by putting women and girls at the center, by looking at ensuring women have agency and structural power to meaningfully and substantially close gaps to achieving gender equality, in partnership with allies and other members. And what does this mean? This is actively engaging women and girls to identify and address social, cultural, and political barriers that are hindering them and their families from achieving optimal nutrition. This first step is really significant. Keep in mind that women and girls are a diverse group with diverse experiences of inequality. And this is where transparent, reliable, disaggregated data is really important, as Mathilde had highlighted earlier. Women and girls are impacted by gender inequality in diverse ways and within different sectors. You can see at the outside of the image showing, there's economically, educationally, within food systems, social protection programs. By putting women and girls at the center, we can look for opportunities for transformational change in current systems and structures, and better identify how to make them more equitable and responsive to the needs of women and girls. The GTFN really helps to illustrate the multisectoral dimensions of nutrition and for a response. At every entry point for action, we need to be able to harness the agency of the individual at the center, access and power to access resources and the opportunity structures needed to drive large-scale enduring change. And in our work, we really need to think, how can we identify these opportunities and really build this agency? And taking a gender transformative approach really helps to put women and girls at the center of that thinking, to unlock the potential of nutrition programs and address gender inequalities. It helps facilitate an analysis of gender power dynamics. So thinking, the power over the ability to exercise your rights, the power within your agency, the power with others to be able to have a collective voice, and the power to access things like resources. This approach helps to shift the narrative of how we look at, think about, and address access to nutrition and nutrition services for women and girls. It helps to link how all of this comes together and is impacted by discriminatory beliefs, harmful social practices, and how these shape our roles, our responsibilities, and our nutritional practices within families and broader communities and economies. As mentioned earlier, COVID-19 has really highlighted gender inequalities and serious gaps within the healthcare system across the globe. But it has also helped to refocus attention and the need for a multisectoral approaches to strengthen public systems for those on the margins, and particularly for women and girls. Nutrition for Growth Summit and this Year for Action is a great opportunity for all of us to come together and collectively advocate for strong financial and policy commitments that put a spotlight on women and girls' nutrition and gender equality. And I think the GTFN is a great tool for advocates to use to make sure that those commitments are as transformational as possible. So I'd like to let my colleague Jasmine speak about the Girl Powered Nutrition Program, which really highlights many of these elements in practice.
Thanks, Sarah. And just wanted to also say thanks to our friends at Results for having us today. I'm really excited to have this conversation. I'll try and be as brief as possible because I know that time is never on our side with these 1 hour webinars. But I'm going to talk to you today, and actually before I start, Sarah, it's just if you can put it into your full screen mode. Thank you. I'm going to talk to you about a bit of a practical example that we've done at NI to try and put this framework into action. Today, I'm going to be talking about the Girl Powered Nutrition Program. This is a program that was co-created between the World Association for Girl Guides, also known as WAGS, NI, as well as girls in Madagascar, Sri Lanka, Tanzania, and the Philippines. This program was established during NI's Nutrition Leverage and Influence for Transformation program, also called the NLIFT program, because we know that we love our acronyms in this industry. This was essentially an innovation incubator program where we partnered with non-traditional partners who weren't working in the nutrition space to essentially help them integrate nutrition into their programming effectively. We decided to partner with WAGs because they're one of the largest global movements that's dedicated to reaching girls and young women in a non-formal setting, and they reach millions of girls every year. So that was a key reason why we wanted to partner with them for this project. So the GPN program promotes girl-led change on the importance of a balanced, healthy lifestyle. It enables girls to be agents of change in their community, nationally, and as well at the global scale. To date, the program has trained 130 advocacy champions with 30 peer trainers who will go on to recruit girls in their countries for future rounds of advocacy training. As I mentioned, this program is being implemented in Madagascar, Sri Lanka, Tanzania, and in the Philippines. So essentially, the program recruits the advocacy champions to participate in leadership training so that they can go on to affect change in their own communities. The program also awards grants to the champions so that they can conduct their own campaigns depending on their own goals with advocacy. And essentially what we see here is that affecting change looks very different in every community depending on what the girls' goals are. The program promotes girl-led change through providing nutrition education on the importance of a balanced, healthy lifestyle, the importance of taking weekly iron and folic acid tablets, and of course, enabling the girls to advocate in their own communities. And I wanted to share some initial positive outcomes that we've seen through the implementation of this program now that it is in its 5th year of operation and unfortunately is wrapping up this year. So the first thing that we saw, which was a positive outcome, was just the overwhelming buy-in to the program itself. A key learning for us has been the involvement of women and girls in every step of the intervention cycle, especially during the design phase. When we were developing the curriculum in partnership with WAGs, we consulted with girls across the 5 countries who were involved with the initial iteration of the GPN program. So they helped us to design essentially the curriculum for them to earn their nutrition badge, and then also ensured that the badge responded to their specific needs and interests depending on their own culture. This also helps them build capacity on the key issues that they would go on to address after completing their advocacy training. The co-creation approach really reaches the girl child and adolescent girls with relevant nutrition information through the curriculum that they help design. The curriculum itself was adapted to the local context, translated into local languages, includes a lot of fun and playful activities, and is just relevant across age groups. So we found that relevant information and the co-creation piece really ensured that this was a program that girls would be excited to participate in. A couple of other highlights I can share is that we've seen in the Philippines, one of our advocacy champions has participated in the UN Science Policy Business Forum on food system strengthening, and will continue with those national level consultants essentially. And then we've also seen that 3 of our advocacy champions have joined the Commission on the Status of Women and will continue to participate in these forums related to gender inequality and nutrition. But really the reason I'm sharing this example of a project that tries to apply the gender transformational lens is because the program really provided the girls with a platform to use their collective voices to speak on behalf of their communities. By giving the girls the opportunity to learn about nutrition while giving them, essentially tangible skills on leadership and how to advocate in their own communities, she then had the tools to go on to create gender transformative change. And I think that's really, the view that we have in order to put this into practice, is ensuring that, girls have the tools that they need to create their own change, whatever that change might look like. So I'll leave it there so that we can go on and answer some of your questions about the framework or about the programming or about this wonderful report that was just released by Results. Thank you very much.
Thank you very much, Sarah. Thank you very much, Jasmine. Very kind of compelling again, and I love the kind of idea of kind of women and girl-centered change and the agencies and intersectionality and all the issues around gender. So on that, I think we're ready for questions. So let's have a look at the chat box. I mean, this is probably not one for me to answer at all, as most of the questions, but there's one around whether the slides of the presentation can be shared after the webinar. I don't know. I'm not sure. Over to you guys.
Yeah, thanks, Alan. So all the informations I've included in the slides are actually coming from the policy briefing. So except one slide when I commented on the Conventions on Women and Girls' Rights. So this one is coming from the report Nutrition as a Human Right, which I can put on the chat box. But, so all the informations and all the pictures, etc., are already on the briefing. So you have all the information already there.
Thank you. Right, a question here from Bilal Akbar. He says, hello, I'm a dietetics and nutritional, sorry, my screen's very small, nutritional sciences graduate from Pakistan. My question is, how many gender-based nutrition projects and programs are currently or previously run by Nutrition International and brotherly organizations in Pakistan? So I guess, in short, they're asked what kind of programs, if any, are Nutrition International doing in Pakistan, or perhaps previously?
Sure, I can take a quick stab at that one. Thanks for your question. So I think we have about 5 projects that are active right now in Pakistan. We're working on a large-scale food fortification program to fortify wheat flour and edible oil with micronutrients in collaboration with Mott McDonald. We also have a vitamin A supplementation program that is active in Pakistan. And we have a technical assistance for nutrition project, which is essentially working with the SUN movement to help countries essentially form national strategies working in nutrition. I can definitely send you a link that gives an overview of some of our programming in nutrition if you want to read into them a bit more. I'll just put that in the chat.
And maybe just to say more broadly about advocacy, and this is the Gender Transformative Framework on Nutrition was launched in December at the launch event for the Year of Action towards the N4G Summit. And from the advocacy perspective, we're really trying to integrate this into our work going forward. So beyond just programming, but also thinking of it as from an advocacy perspective, and how do we make sure we really have that focus of women and girls at the center of our advocacy work.
Thank you, Sarah.
I don't know, result program.
Thanks, Sarah. So we have a question here from Mary from Tanzania. So Mary's a gender and a youth advisor in an agricultural program. And she's similarly asking whether you have partners there, looking for possible areas of collaboration or synergies, perhaps. So over to, I think, Nutrition International.
Perhaps on this part, we can share our contact information and people can reach out after the presentation or after the webinar, and we can make sure that they're connected with the right people within the organization.
There's one here under anonymous. So what opportunities do you see or want to create to include transgender, women's and trans, feminine, non-binary individuals in women and girl-led change regarding nutrition access? So yeah, just I guess that's the involvement of trans, non-binary individuals in kind of women and girl change. Do any of you want to take that, or?
I mean, I think from the gender transformative framework approach, I mean, all identities within the spectrum of gender would be included and should be. I think this also speaks to the point that Matilda raised about disaggregated data and making sure that people are making sure that there is a recognition that different women and men experience barriers to nutrition in different ways and in different contexts. And a really key component of that is making sure that it's recognized and measured and integrated into how people are, the identification is recognized. Matilda, if you wanted to speak to that too.
Thanks, Sarah. Yes, indeed, it is important when we talk about women and girls' right to also include people who menstruate as well. And as I mentioned, the structural underlying causes of malnutrition needs also to overview the also the socio-economic issues attached to them. So in our advocacy, as Sarah mentioned rightly, having disaggregated data and I would say more research on the good practices and programs that work, and more information on this is absolutely needed as we continue to advocate on this. Yes.
Thank you both. I have a question here from Maddie. To what extent, if at all, do you think nutrition should be built into other programs? So kind of similarly to kind of gender mainstreaming.
Yeah, maybe Sarah can take a quick stab at that, and you can jump in. So I think that was one of the great things about our partnership with WAGS for the GPN program, is that WAGS was previously a partner that was not working in the nutrition space, but was reaching millions of girls each year. And, you know, NI has done a lot of work with a lot of different partners in the private sector or NGO sector, or academia, whatnot, who reach a lot of people every year with health interventions, but don't know how to effectively integrate nutrition into their programming. It's actually very, you know, cost effective to integrate nutrition into your programming, especially if it is a health project. And so you can see great results with that integration. So I think that it's, you know, it's a great opportunity, and it's a great way to ensure that, you know, young girls aren't left behind. Sarah, if you want to jump in, maybe.
Yeah, actually, I'd be really interested, Mathilde, in your work on the brief. I mean, so what comes to mind is also looking at other platforms such as education, and you mentioned it in your presentation. I'm wondering, not to pawn it off to you, but I'd be interested to hear what you found in relation to education.
Thanks, Sarah. So actually, so in the briefing, when we present education, we highlight two main interventions that are necessary for enhancing both the education, education outcomes and nutrition outcomes of children. So these are school feeding, but that should include nutritious meals available at school, but also nutrition education. So these two are complementary, and especially because there is a convention specifically looking at children's rights, and when they talk about their right to health and education, they really highlight the fact that nutrition education is a fundamental step for enhancing education outcomes, but also nutrition has the dissemination of information and knowledge on how to prepare a nutritious meal, how to produce this food, but also how to adopt hygiene and good sanitation practices are necessary. And we also precise that nutrition education should be delivered to everyone at all ages and should not stop at school in order to be very inclusive. So this is how we presented that in the briefing.
Great, thank you, Mathilde. So we've got about 6-7 minutes to kind of ask a few more questions. So here, I think it's Didi, rather than question, I think it's was very interested in the multisectoral nutrition program. I think, Mathilde, you talk about that quite a lot in your report, and just wondering about, you know, sharing experiences to the approach, particularly focus on grandmothers that particularly worked. So I guess, Mathilde, is there a way of, do you have your contact details available, or can they be made available for any collaborations and sharing of experiences?
Thanks, Alan. Yes, I can put my email in the chat box, but my email is also available on the second page of the briefing as well, in the acknowledgement page, but I will put that in the chat box now.
Brilliant. And then someone else, I think Melanie, just saying that there'll be some work building on the GTFN work mentioned by Sarah and Jasmine in October. So that's kind of everyone kind of watch out for that and do get involved. Question here from Push, who says the best results in nutrition provision with the intersection on education seems to provide more integrated outcomes, especially girls' education. What is your experience on that? Hi, Push. I know Push.
Yeah, I can speak to that, and I think it's a bit similar to what I was alluding before. I think that an integrated approach is always the most effective. I can very quickly refer to another project that we have as part of our innovation incubator. It was working with the Bangladesh Knitwear Workers Manufacturing Association in Bangladesh. And essentially that program was providing nutrition education sessions and iron folic acid to the young girls and women who work in the knitwear industry in Bangladesh. And, to us, we found a lot of really positive outcomes by combining not just the provision of fortified foods, iron folic acid, but also coupling that with nutrition education. And I think another great thing about integrating nutrition education into an intervention is it's an opportunity to also talk about gender inequality. It's an opportunity to also, provide an intervention for quality A and C care if your interventions are actually happening at the health facility level, if not in the community. And so that integration is an opportunity to basically layer in other things that are going to ultimately work towards improving someone's health-seeking behavior.
Thank you, Jasmine. There's a question here about, so a lot of the discussions have been around low-income countries, and given the similar patterns across the world, do any of these frameworks, can you see them applying in higher income countries? I'll leave it to one of you to answer as you will.
Sarah, maybe?
Yeah, no, just sorry, I smiled because of course I think all human rights obligations apply everywhere, as well as gender dynamics and power relationships are evolving and changing, and they manifest everywhere. And even as you go through and things change over time, new dynamics will emerge that will need to be addressed. I think it's an ongoing, evolving process. And certainly all countries can benefit from taking a more gender transformative approach to all of their work in nutrition and other sectors as well. And I would say the same about the human rights approach as well.
A question for me, okay, and excuse my ignorance. So we talked a bit about kind of women-centered approaches and agency, and then the N4G Summit. Now, I don't know how the agendas are working and whether they've been released or not, but is this ordinarily, or is this likely to be a theme of the N4G Summit? If you know, and if not, that's fine. And if not, what do you think other nutrition advocates can do to get this on the agenda of global governments?
Yeah, I think that there has been an expression of interest for this to be. I mean, certainly at the N4G Year of Action launch event, Canada stood up and was a champion behind the framework, and have been for many years and continue to be. I do believe in other conversations with other governments that the recognition of making sure that women and girls nutrition is really highlighted has been raised. I'm sure others have experienced that in their advocacy work and efforts. So just because it's mentioned and just because it's being brought into discussions now, it doesn't mean that it needs, advocating for strong approaches and policy and financial commitments are a sure thing. I think the work still needs to be continued and beyond the summit as well. And just making sure that there's a lot of financial commitments and policy commitments are not stopping at the end of the year. They're going to continue, and being able to monitoring them, making sure that there's effective accountability structures, making sure that budgets that are committed now actually come to fruition in the future, et cetera, et cetera. I mean, it's an ongoing advocacy call.
Mathilde, did you want to add anything to that?
Thanks, Alan. Yes, actually here in the UK, we are facing an unprecedented situation as the UK government decided to cut UK aid. So for us in the nutrition sector, it has been very disproportionately affected. However, the UK government still continues to promote gender equality through girls' education. They want to champion themselves as human rights champions. So I think our advocacy here, which has also been I think it's very important for us to work across sectors, as this is mentioned in the briefing, really to really show that the work on girls' education will be maximized and sustained if nutrition is also a priority for the UK government. And those commitments must be shown at the N4G Summit through political commitments, but also financial commitments. It's very necessary. And the Independent Commission for Aid Impact in the UK, which is independent identity from the government scrutinizing UK aid, they often also mention that a multisectoral and a rights-based approach for nutrition is needed for that purpose, which is why our advocacy is really keeping this on.
Thank you, Mathilde. Thank you, Sarah, as well. Miriam's just shared some information here. So around institutional donors' contribution to gender equality. So do have a look. So I think we're approaching a few minutes to go. I can't see any other question. As I say that, there is a question that comes up. Okay, so that's just a question for Nutrition International around kind of internships, I think, perhaps in Pakistan program work, but I think, yeah, people can get in touch, I think, perhaps if they want to engage in that more, but thanks for asking the question. So just a few more minutes left. I don't know if that means I'm a good chair or a bad chair, but perhaps if we've got a few minutes, do you want to give the panel an opportunity just to make any final closing remarks? So they don't have to, but just if there's anything that you think is quite important to say before we end the webinar, here's your chance.
So from an advocacy perspective, I just want to reiterate, it would be really interesting, and I think it's really important to have collective voice around the importance of women and girls nutrition and advocating for that towards N4G and beyond, not just for this year. It would be really interesting and great to hear what others are doing and you know, the different, especially those working outside of the nutrition sector. This is a great opportunity to hear and collaborate and try to find ways that we can leverage opportunities to really push that message.
Anyone else? I'll take silence as no. Mathilde?
Yeah, thank you, Alan. I just wanted to know if Jasmine wanted to follow up Sarah's remark. So I will say, so now we are reaching the middle of the Nutrition Year for Action for the upcoming Nutrition for Growth Summit, and an effort that we need to push on, not just in the UK, given the situation on UK that I mentioned, but everywhere. We will need to build bridges with other development sectors. So I mentioned education, but this is not the only one. Like, we need to keep trying to talk to other multilaterals, other donors, in order to ensure that nutrition is mainstreamed in other development programs as well, where relevant, because nutrition can be seen sometimes as a bit niche, but this is an essential intervention everywhere to ensure the realization of the right to health. And we have 6 to 7 months until the Nutrition for Growth Summit at the end of the year, so need to keep the advocacy efforts on that. And I will also end by thanking you, Sarah and Jasmine, for your presentations and for supporting us in our advocacy as well. It has been brilliant to see what you've been up to for defending women and girl nutrition.
Yeah, thank you so much for having us as well. Perfect. And for everyone who joined.
Jasmine, do we?
It was unmute Olympics, so I just wanted to say thank you. This has been exciting. You know, it was nice to hear from participants all over who are looking for ways to integrate nutrition into their programming. You know, I'm always excited to hear about that. So yeah, I'm looking forward to reading the report, Mathilde.
No, thank you all. Firstly, the panelists. I mean, it's not easy giving such compelling presentations at any time, let alone on a Wednesday. Sorry for the UK time focus, but for us in the afternoon. And equally, thanks for such an engaged kind of audience. Great questions, great pointing to other bits of research, and particularly, you know, those coming from a Global South perspective, their perspectives need to be hearing more of as well. And we do have contact details on the report, so do get in touch, and I think collaborations and opportunities for that are always good as well as further questions. So thank you, everyone. On that point, I think I'll thank you along the comments box. I can end it 4 minutes before time. Well done.